Hello, my name is Omar Escontrillas, and I'm the Senior Vice President of Equity, Research and Programs at the National Health Council. Here at the National Health Council, our mission is to provide a united voice for the 160 million people living with chronic diseases and disabilities and their family and caregivers. I am pleased to be joined by your trusted messengers, experts, and advocates who are particularly well-equipped to share perspectives about why these health disparities are so pervasive, what communities at higher risk for chronic conditions can do to manage their health, and successful strategies to make impactful and meaningful changes to improve health equity in chronic diseases. As always, we encourage you to talk to your trusted healthcare provider for medical advice and to make your own health plan. With me is Tara Chico Jarillo, a member of the Tohono O'odham Nation and the Interim Executive Director at the Pascua Yaqui Tribe Health Services Division. We're also joined by Wendy Hernandez, who is a co-founder and co-executive director of the Illinois Community Health Worker Association and the founding board of the National Association of Community Health Workers. Finally, I'd like to introduce Patty Neese. She's the immediate past chair and current committee member of the Obesity Action Coalition. Thank you all so much for being here today. Let's get on into the discussion, shall we? All right, well, I'll start with Tara first. Tara, from your own perspective and working with Indigenous communities, can you tell me what chronic disease means?
So chronic disease, I think when the communities I work with, it definitely means like long-term illness. I think that's how people see them. Also like what does that look like in our communities? And so specifically, I think I talk about, diabetes, cardiovascular disease. It's really, the community perspective is I'm gonna get the disease and I'm always gonna have it. And so it's long-term.
Tell us a little bit more about what effective ways local hospitals, community clinics, tribal health departments are overcoming these access barriers to prevent chronic diseases such as obesity, diabetes, and heart disease.
Yes, definitely. So, I always think in Indigenous populations, I think there's always this underlying assumption that, well, the federal government pays for care, so that definitely is a direct link to having access to care. And that's not the case. And so for the tribes that I've worked with, mostly in Arizona, they've been really innovative with how they take their federal dollars and provide access to care. So specifically now for the tribe that I work with, they've basically stood up their entire health department to meet these needs where we don't have access. So you talked about transportation. We have our own transportation department within our healthcare setting. We have a whole community health nursing program. We have our own pharmacy. We're in the process of looking at, what does our ambulatory care look like? So it's really being innovative and how we use federal dollars to provide that access to care.
And if you think about it, that's how chronic disease has to be treated. Multifaceted. When I finally got treatment for my obesity that was science-based, it was multifaceted. I had psychological care, I had medical care, I had nutritional care, I had movement and exercise care. It takes it all. Same thing with diabetes and heart disease. It's not one facet. Everything you talked about has to be taken into consideration. And it's rare, at least in my experience, that you see organizations like yours that have a big picture. You got to look at the bigger picture with all these chronic diseases.
Yeah, and become more innovative, right, in terms of how to actually reach and educate not only our Black and Brown communities, but also educate the people that we represent, which is either the healthcare system or whatever, because that is very important. And I feel like that is the lack, right? That is what holds the information, and that is what actually doesn't really help our community grow, right? And so I just feel that in my situation, as we have community health workers who actually are from the communities being served, that actually look like the communities and also have health conditions themselves. And the reason that they are doing the type of work is because they were either stereotyped or really didn't actually receive the health quality care that they deserved. And they had to really work very hard to be where they're at, right? And so that's the reason why we want to protect our communities.
Tara, I want to ask you too is, can you share an example of the work that you've done specifically on driving positive health outcomes?
We are working on having this one-stop shop, and it's where everybody can get their services together, which we don't see that a lot in tribal communities because we're always referring out, right? How do we bring providers in? And so that's like one of our biggest things that we've done, and we do see the impacts. You know, we look at like our no-show rates, you know, who didn't come, but since we've brought in resources back into the tribe, like our own pharmacy and how it links to the primary care we provide, we see those rates go down. We see more people are coming to their appointments, more people are picking up their medication. We also, hand in hand, we have a naturopath on staff who does holistic medication. Those are the positive things we're working on, is really just bringing this immersion together of two worlds, but also like bringing the need into the community.
You brought up about, you know, culture and making sure that you don't forget the community, how important culture is to all of us, right? And how that is an important factor of how we view healthcare. And so having that connection between Western medicine and then, our cultural upbringing is so important within communities. So thank you so much for highlighting this for us. Patty, I wanted to ask you, I know you've been involved in policy and advocacy. So what role does policy reform play in reducing healthcare access barriers, and what specific policies can you potentially highlight for us that impact reducing health disparities, or at least help to reduce health disparities in these chronic conditions?
Right. Certainly legislation can help if you can find sponsors and push it through. But I think the point I want to make on this is you have to play the long game. Policy doesn't happen quickly. It takes a while. And it gets frustrating when you're a patient advocate. You want that change now. I want it now, today. When I walk out of this room, I want that policy change accomplished. But that's not how it works. Whether you're on the legislative side, the regulatory side, trying to get regulations put through. And the other thing I want to emphasize is it takes education of everyone. And we have spent in the obesity space tons of hours educating legislators and other policymakers and patients and medical professionals, that obesity is more than just food. It's more than just exercise. There's all this complex biology going on in your system. So I think that playing the long game and education of everyone is clear, and we've had success. We've seen some legislators come around to understanding that most of us with obesity have tried whatever we can to manage our weight on our own and just haven't been successful. There's more to it, and they're finally understanding that. It's been education.
One of the pieces that you brought up, all of you again in this last segment, is that how so important beyond numbers, and data is important. We all agree that data, numbers, statistics are important, but that patient experience, that storytelling of where they come, what has been the struggles, what have been the challenges, but also what have been the successes. And I think here at the National Health Council, we do so much groundwork to uplift those patient experiences because they're valuable in moving regulation and bringing in to the forefront what are these challenges. And it's important to tag along with the quantitative or with those raw numbers, but that patient perspective, community's perspective, their stories are so valuable to the work that we do.
I have always said in every community I work in, the community actually has the answers. I think our role is to help them mobilize their solutions. And, because they know what works, they likely know why it's not working. So how do we use our skill to mobilize them to build those answers?
Excellent. I love that. Mobilization, really leveraging our own skill set because we all come from different walks of life. Wandi, we talked about community health workers. You've done some valuable work in really bridging the gap that exists between community health workers, policymakers, and researchers. We know that oftentimes there might be some gaps. What is one example that you can share with our audience where this collaboration has helped to improve health outcomes in the community between promotores, between researchers, and then taking it to action into the policymaking?
Well, we did have, like I stated earlier, our CHWs are actually come to us since we're the Illinois CHW Association. They come to us in regards to different types of challenges that they face in their workforce, in the type of work that they do. And one of the CHWs actually came to us, who is very active leader within her community, came to us and she was like, you know what, Wandy, we really want to actually get ourselves a little more educated, but want that education to be in Spanish. A lot of us actually speak Spanish, we read and write it very well, we're still having challenges in English, and so it would be great if we can have, development trainings in a community college, give us those skills. So there are community colleges out in Illinois that are providing CHW certificate programs, and there was one community college in particular who actually resides very close to the Latino community and wasn't offering any courses. And so they really wanted us, meaning the Illinois CHW Association, rather me, to go over there, they call me the godmother, to go, la madrina, to go over there and assist them in actually making this a reality. Overall, it came out perfect. I mean, now the CHWs are actually, fulfilling their dream, going to school, and learning these classes, in their native language and being able, and we provided them with the books that they needed to be able to do so.
Thank you so much for that. I think we know that education is power.
Yeah.
And it really allows us to fully comprehend and also able to connect. And education is so valued in the work that we do, and all of you have beautifully articulated how important that is within our communities that we all serve and the communities that we belong to. So I really appreciate all of your comments today. As we have discussed, chronic disease is a concern for millions of people across the country, and folks in underrepresented and marginalized communities are more severely impacted by heart disease, diabetes, and obesity. Here at the National Health Council, we are proud to uplift those trusted voices like yours and share accurate information, not only about health risk and how to manage one's own health, but also about how communities can work together to address the stigmas, the barriers that stand in the way of better health outcomes for us all. Thank you again for sharing your time and your insights with us. And thank you for watching. Please take this information and share it with your loved ones and your communities. And again, be empowered, take action, and always be sure to talk with your healthcare provider and make a plan that best addresses your specific needs. Thank you.
Thank you.